Scott Weingart uses the push dose phenylephrine.
He used to. He stopped. God, that was like Weingart 4 months ago. That's ancient Weingart. Jesus.
No.
That's like 2014 crap right there. Like, I don't know.
I saw it on recently was for an unstable AFibber where you don't want to give epi and to make them more tachycardic, so you give the push dose phenylephrine. That's what I'm talking about.
Phenylephrine.
That's the 2016. I don't know if you guys
touchy drug.
Phenylephrine, you can get into trouble. There's not as much trouble that you can get into with epinephrine if you give it to the wrong guy. You can kill people with phenylephrine pretty easily. If they don't have a good ticker, like if their heart in congestive heart failure, and you clamp down exclusively the peripheral, and you give it to them, they can go into rapidly decompensated heart failure in a hurry. That's not as much the case with epi because you're also beta flogging the heart as well. So that beta agonist is helping to make sure that the heart is also increasing its strength as well. Again, there might be a very narrow, on like a really sick, crashing, hypertensive AFibber that it might be, but slow your roll before you just mix phenylephrine, which is also a really technically challenging drip to mix because it comes in bigger bags and you got to do more math. I don't ever use that.
Okay. Yeah, it was on First 10 EM Twitter like last month.
So yeah, and you can consider making that drip. It's just a lot more of a pain, and I don't think we have the resources to quickly get it because they'd have to get that from pharmacy anyway. So I hardly ever use phenylephrine for almost anything. Talk about the dirty epi drip. I'm trying to remember the exact math, but it's basically sinking a milligram into a liter of saline, and then you titrate. It's hard to kill people with drugs that you put into a liter of saline and then titrate. Like I'm serious. If you put a bunch of Dilaudid in a liter of saline and then titrate, you're probably not going to get into massive trouble. Like that's a commonly forgotten thing, that you can dilute your medicines. So you can absolutely put a milligram of epinephrine into a liter of saline and watch the patient and twist the dial. And almost any dose that a normal IV is going to be able to give that person is not going to be lethal. Because worst case scenario, if they got 300 mLs really quick, that's very similar to the 0.3 milligrams that they would have gotten IM for a typical anaphylaxis patient.
Same with ketamine. The new thing is ketamine drips they've been doing too also.
Yep. You can drip lots of stuff. If you've got a person that's opiate, like an opiate addicted person, you want to treat their sickle cell pain, but you don't want to get them super high, and you want to give them a liter of fluid, you can totally sink that one of Dilaudid into the liter of fluid and give it to them over an hour. You're still being compassionate, yet you're not going to have as much euphoria. You want to start a ketamine drip?
Which would argue, are you being compassionate? You're not treating why the patient came, Dan McCollum.
It's fair. But people don't do that often enough. You can actually make your own drips of pretty much anything you want. If you want to put some, for example, promethazine or Phenergan is actually probably moderately dangerous in bolus form. It's really safe if you put it in a liter of fluid comparatively. And so you don't have some of the... There you go. So like Compazine, like even if you put slow push, like sometimes it goes in a little quicker than you want. So do you want to sink that into a liter of fluid and give it that way? It makes for a very elegant headache cocktail. You just got to talk to your nurses to make sure that they know what's up.
Speaking of combination ones, I've heard there are certain things like blood and LR you can't mix together or something. That's a myth. I looked it up later. But are there things that come up off the top of your head right now, just like bang, 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 just a couple pearls or things that you can't mix going in together?
It's mainly like talk to your critical nurses because they're the ones mixing all the stuff in there.
Nurses know this much better than us. So before you combine, especially disparate medication classes, be careful, particularly when you're talking about blood products. So classically, you're not supposed to mix LR with blood. It's probably an exaggeration of the problem, but I still wouldn't do it. I would still just use normal saline because we don't have enough data for that. But for the most part, talk to your nurses, especially if it's not something that you've seen before. And then as you get more and more tricks of things that you can mix, like typically your opiates actually mix well with other things, but some of your larger, bulkier agents like albumin, if the rare patient that you're giving albumin to, that bonds to a lot of drugs, for example. Blood products interact with a lot of drugs, and so whether you could mix Dilaudid with blood with lactated ringers, I don't know. But it gets more and more complicated if you're not using small molecules with it, because it may precipitate.
I don't think we run into it as much in the ED as like in the ICU, but the nurses up there, they have an IV, like a peripheral IV manager. I think it's incorporated into CERN or whatever, and it'll tell them what they can push in what lines. And I actually had this come up last week that they said, hey, which one of these drugs do you not want, like right now, because I can't put all these through a peripheral line, or just throw a central line to the patient. Yeah, that's so they have that, and when somebody's on 5 or 6 different drips through a couple of peripherals, that's when it comes up.
We have it too. It's in between C2 and C3.
Mhm.
That big, ugly poster that we never look at. You can cross check every medication if you want.
They actually have it's a computer program that they print it out and put it in the patient's room. Like these are what you can put out into what IV.